It's really exciting for me to get to introduce Jordan tonight. So Jordan is a child life specialist in the pediatric or in the children's specialty clinic in the Chapel Hill location at UNC. And so Jordan's been a child life specialist for 8 years, and she's been at UNC for 6 years. She started in the PICU and then moved down to the children's specialty clinic, where she's really kind of created the program for child life down there. So Jordan started her career with a bachelor's degree in psychology from UNCW and an internship at New Hanover Regional Medical Center, and also at looks like St. Joseph's Hospital, Children's Hospital in New Jersey, which is really exciting. And Jordan really shared with me that her favorite part of her job is watching the children that she works with develop new coping skills and overcome, a lot of the challenges and the situations that they've been working through. So with that, Jordan.
Thank you. Thank you for the introduction. I'm going to try to share my screen with y'all now, so I apologize if it says host disabled participant screen sharing. I don't know if that's something that we're able to.
Yes, I need to make you a co-host. Hold on a second.
Okay.
Or Ellen can, but I have it. Yeah. Sorry, I meant to do that in the beginning, but we were talking.
No worries.
Okay, now you should be able to share your screen.
Perfect. Okay. Sorry. Let's share that one. And I'm hoping I can get it so that y'all can see the actual presentation. There we go. Okay. I apologize because I've got a few notes just next to the screen, so I might be looking kind of back and forth. But thank you guys for having me here to talk with you all tonight. I'm really excited to get to share some information about what child life is and the work that I do, and hopefully some good tips and pointers for families to take it back and use with your kids in your daily routines and in your daily life. But we're going to talk about ways that you guys can help to make your clinic visits hopefully something that is a little bit easier and a little bit a smoother process if we can make it that way. So to start, we'll just talk a little bit about what is child life. Child life is a field designed to help children with their ability to cope with their healthcare experiences. Mostly we're found in the hospital setting and in some outpatient settings. There's a few very lucky outliers where people might work in like a dentist office or in an advocacy center, but by and large, we're in kind of major medical facilities. The way that we help kids and families to cope is really pretty broad. We do it in a lot of different ways, and from day to day, our job can look very different depending on what the needs of those kids are that day. But we do a lot of play, preparation, support, education, distraction, and self-expression activities. We have a minimum of a bachelor's degree. In most people, not most, but many people also have a master's degree as well, either in child life specifically or in a related field. We do practicum experiences, 600-hour internships, and then a national certification exam. So there's a little bit of a process to work your way through it. We have a lot of training in child development, family systems, anatomy and physiology, play, grief, all sorts of different topics relating to the field. And like I said before, we maintain through continuing education. So we're always looking to grow and expand our knowledge. The medical field changes really quickly, so we have to make sure we're keeping up and providing the best care that we can for our kiddos. At UNC, we are really lucky. We have, when we're fully staffed, 21 child life specialists, which is a pretty big team for the size hospital that we have. Right now, I think we're at 20, so we're almost fully staffed. We work in just about every area where you would find kids in the hospital. So all of our inpatient units have at least one, if not two, child life specialists. We have people in our intensive care units. In the outpatient setting, we work in the OR, the sedation suites, oncology clinics, the emergency department. Like Ellen said, I work at our Chapel Hill specialty clinic. We also have people that work out at our Blue Ridge location. And we have 3 psychosocial support coordinators who are child life specialists by training, but do more of a programming role versus the clinical work that I do most days. So like I said before, child life is kind of a broad field. We do a lot of different things, but I tried to kind of boil it down to these 8 sort of points. So we do a lot of procedural preparation and support, medical play. We teach coping skills. We help kids learn how to swallow pills or find ways to help them take their medicines. We do family and sibling support, adjustment to the medical setting, legacy building, and then just sort of typical developmental play, developmental stimulation for infants and toddlers, and then recreation and normalization. So first I'll talk about procedural preparation and support. This is what I spend by and large most of my time doing, at least in the specialty clinic. We have kids having lots of different procedures done, typically, or most commonly, I would say probably lab draws, but lots of different things happen in that clinic. So we're working to make sure that kids are feeling prepared and know what to expect when they're having a procedure done. So we work to communicate really accurate and developmentally appropriate information to kids before an experience happens. Our providers are fantastic and incredibly intelligent, but often talk in words that don't necessarily make sense to kids. So our job is sort of to act like translators and to help make those things make sense for kids. So in that process, we usually use something called the 3 S's. So we talk about the sites, the sequences, and the sensations of whatever that procedure is going to be. So what is a kid going to see when they go for their procedure? What does the room look like, and what sort of equipment is going to be in there, and what staff members are going to be there? We talk about the sequencing. So what order are things going to happen in? First we'll put on the tourniquet, then we'll look for a vein, then we'll clean. And then we talk about all the other sensations, that what they might feel or smell or hear while a procedure is going on, so that they are not surprised by anything. They know exactly what to expect and what is going to happen during that procedure. So that's sort of the preparation piece of it. We're also present to provide support during a procedure and to try to help kids stay calm and relaxed and help get through things as smoothly as we can. Most of the time, we'll be working to provide distraction and diverting attention away from whatever that potential stressor might be. We look for opportunities to allow kids choices. So letting them choose what their distraction would be if they want one. Some kids might like to play on the iPad. That's always kind of the big hit. Or they might want to look at videos of their dog on mom or dad's phone, or blow bubbles, whatever it might be. We try to let them have some control and some choice in what that distraction might be, and really encourage kids and parents both to be part of developing that coping plan that we're figuring out before the procedure starts. Kids, especially once they've started to, they've maybe done lab work a few times, or, they've had their throat cultures done a few times, they start to figure out what works for them and what they prefer, and parents are the experts on their children. So I like to really collaborate with parents and with the kids to try to figure out what is going to be most beneficial as we head into a procedure. We try to acknowledge all of the feelings that kids are experiencing. There's a big range of emotions that can happen when you're coming for procedures and having things done, and they're all very normal. So we want to make sure that we're validating how kids are feeling and finding ways to help them deal with those emotions. And then we're advocating for things like pain management, comfort positions, one voice, and other coping aids that we have that we can utilize. And I'll talk a little bit more on this next slide about what a couple of those are. So one voice is a technique that we use to try to create the least threatening environment for a child in a procedural setting. The main sort of pillar of one voice is that only one voice should be heard during a procedure. What we see happen all the time is when a child starts to get upset in a procedure, they might be crying or yelling, and their voices become a little bit louder, and then with the best of intentions, all of the adults in the room, we get louder because we want them to be able to hear what we're saying to them. And then they get louder and then we get louder. And it's just kind of this cycle where the room starts to be really overstimulating, and it can be hard to really focus on those coping plans that we've tried to put in place. So that's sort of the big takeaway for the One Voice, is that we're establishing one voice for the child to hear during a procedure. A lot of times that's a parent just providing comfort and soothing their child, and sometimes it's me providing those cues about what's going on, what they're about to experience, but just trying to keep that environment as calm and relaxing as we can. The rest of the letters in the words one and voice all stand for other sort of concepts to utilize. So the need for parental involvement, educating patients before the procedure, validating the child with your words, offering the most comfortable and non-threatening position, individualizing your game plan, choosing the appropriate distraction, and then eliminating unnecessary people who aren't actively involved. All of these things are really just to try to help make that setting as comfortable as we can for kids, and to try to get through things with the least amount of trauma as we possibly can. And then comfort positions are really just ways to position a child with a parent or with a staff member on their lap so that they feel like they're getting a hug from parents versus having to be held or restrained during a procedure. There's a few different little pictures on this slide. The ones that I find that I use most frequently are that top left one, that chest to chest position. That's really good for younger sort of toddler age kids, where they just sit on mom or dad's lap with their chest to mom or dad's chest. Then mom and dad can hug around, and those are good for like injections. You have flu shots in the arm, or if we're doing vaccinations in the thighs, that's a good position. And then that bottom right one, the back to chest position, I use most commonly in phlebotomy, just with a child sitting on your lap with their back to your chest, and then mom or dad can hug around and help keep those arms stabilized. And if we needed to kind of use legs to help keep the kids' legs nice and still, we can do that too. But these are really just designed to be the least threatening setup for a child, and not having to have as many people involved in holding or trying to bring more bodies into the room. When we use these, our hope is that we can have the least number of people and just try to get things done as quickly and safely as we can. So for each one of these sort of child life techniques that I'm going to talk about, I want to go into a little bit of like the DIY and how you guys can utilize these different techniques at home. So for procedural prep and support, my DIY suggestions are: first, to ask for child life. If you are at UNC and you're at the medical center, like I said, there's lots of us there. So even if you don't see one of us or see me when you're in clinic, we are around, and the staff can always call us. So please just ask, and we're usually pretty good about getting there as soon as we can. When we're getting ready for procedures, it's best to be honest with kids about what's going to happen. We want to use simple but accurate words to help them know what to expect during a procedure. It's always with the best of intentions, but sometimes when kids ask questions, adults, they don't want to scare them, so they might not tell them exactly what's going to happen. And sometimes that can have the opposite result of what we want, and can end up making kids a little bit more anxious. So we want to find accurate words to describe what's going to happen that don't tip over into being frightening necessarily. We want to create opportunities for choices. In the healthcare setting, kids have very few choices. There's a lot that is outside of their control that they don't get to, have choices about. So when we can find ways to make that happen, we want to offer kids as many choices as we can. A lot of times that might just be something like, if you're in phlebotomy, asking, do you want the phlebotomist to look at your left arm or your right arm first? Because that is an option that's available to them. We couldn't necessarily ask them, where do you want to have like which arm do you want them to use, because we don't know where the vein is going to be that's going to be the best one and where that phlebotomist is going to go to draw the labs. So asking that question isn't actually a choice that the kids have. But if we word it right, we can really give kids a lot of autonomy and a lot of control in a situation. One that we do all the time is I'll hear families ask, or nurses especially ask, do you want to take your medicine? Like, that's not really a choice, right? Like, because we're setting them up to be able to say no to that, but that's not really a choice. You need to take your medicine, but you can say, it's time to take your medicine. Do you want to drink it with water or with apple juice? And those are options that are realistic and available to them. So when you're thinking through, getting ready for a procedure, you just want to look for those opportunities to create choice and increase a child's sense of control in that setting. We want to clarify what their jobs are going to be. Everyone feels much better typically when they know what's expected of them. Us as adults too, and kids especially. For procedures, it basically doesn't matter what the procedure is. 2 jobs that I always tell kids are staying still and taking deep breaths. Those are pretty much always going to be something that's helpful regardless of what the procedure is. Like I mentioned before, we want to respect emotions and validate how kids are feeling. Sometimes kids will feel almost embarrassed about being scared or being worried or crying when something is hard. And we want to let them know that those are all completely normal responses to something that's stressful, and it's okay that they feel the way that they feel. We want to provide specific praise in that situation. It's perfectly okay to say you're doing a great job, but it's really helpful to say you're doing a really good job staying still, or I can see that you're taking really slow, deep breaths, like you're doing a good job taking deep breaths, and really identifying specific behaviors that a child's doing, that they're doing well, or that you can see that they're trying, because sometimes procedures just don't go well and kids have a really hard time coping, and it's still appropriate for us to say, I know you're scared. I can see you're doing a really good job trying to stay still, even if, we're needing to help hold them still. We want to really find ways to help sort of make them see that they're doing a good job, and help them to know that they're doing their best and that we see that. And then we want to utilize those comfort positions and ask for pain management techniques. So in our clinic, we have several different options that we can use for pain management. I apologize because the one all the way on the left, I just learned is not actually going to be available for much longer, but the other 3 options all are. So that one with the green lid is called Pain Ease or Freezy Spray. And that's just a spray that we spray on the site of a needle stick that helps to numb the skin. It feels like someone put an ice cube on you. It's really chilly, but it helps to kind of take away that poke or pinch feeling. The cream, the LMX cream, is just another topical numbing agent. It's like a lotion that they'll put on 20 minutes before and cover it with a little sticker and let that sit. I've used it before. It's really a strange sensation because you can still kind of feel touching and tapping, but again, takes away that painful piece of a needle stick. And then all the way on the right is Buzzy, and that is just a little vibrating device that we use. You place it above wherever the needle stick is going to be, and what happens is your brain actually receives that vibration signal before it receives a pain signal, and so you feel more of the buzzing and not so much of a poke feeling. The caveat to all of this is just to ask for it before you leave our clinic. Unfortunately, our phlebotomy in the main medical center doesn't have access to these devices, but we have them in clinic, and I have them personally. So if you know that you're going to go have some lab work done, just ask about numbing cream or ask about Buzzy, and we'll make sure that we get them for you, and I can meet you in phlebotomy and make sure that we have all of that stuff available. So next we'll talk about medical play. Medical play is a way for us to integrate preparation and teaching using either toy medical equipment or real medical equipment if it's appropriate. Kids learn through play, and they explore the world through play. They express themselves through play. So this is a way for us to meet kids on their level and use their language to help teach, and also for us to understand how kids are perceiving their medical care. This is a really great way for us as child life specialists to correct misconceptions, or to understand what kids are thinking about their medical treatment, how they're viewing it, and to help answer questions that they might have. And doing this really allows us to help a kid become more desensitized to the materials and the equipment that's going to be used during their treatment. And we use it really as a teaching opportunity to help kids understand what a procedure will look like for them. But this is always a really fun activity. This is one of my favorite things to do. And you can see there's lots of, cute little pictures and stuffed animals and the little Fisher Price doctor's kits that we use, but it's a really great way for us to help provide some education in a way that's really fun. For the DIY version of medical play, I just encourage you guys to engage your kids in play with the doctor's kits. They sell them at Target and Walmart and Amazon. They're just about everywhere, pretty easy to find. I also have some in clinic if you would like one, so let me know. And then allow your kids to explore the materials and really act out the medical encounters that they have been through. Really without much direction, most kids will pick up any of those things and just start using them. It's really fascinating to see kids. They know exactly what all of it's used for and how it works. And our kiddos who have been coming to our clinic for a long time, right away, you can kind of see exactly what they've been through, because they just play right through everything that they've had done before. Another tip is just to use this time as you're playing with your kids to address those misconceptions. If you see them, use a piece of equipment in a way that is maybe not its intended one, it's of course okay for them to do that. But it's helpful for us to be able to, kind of say like, oh, this, goes on your chest, that little stethoscope goes on your heart, or to help them kind of better understand what's going on or why we're doing the things that we do. And then we want to just use this time to model healthy coping strategies while you're playing. So, if your kiddos are giving their teddy bear a shot, it's really helpful to, say, does your teddy bear want us to count 1, 2, 3 before the poke, or do they not want us to count? Or does your teddy bear want to take big, deep breaths, or does it want to blow bubbles? And we can really kind of practice those coping techniques while we're playing and help understand what each kid might like to do for themselves when it's their turn to have a procedure done. So next, we'll talk about coping skills and pain management. There's several different techniques that I use most frequently. I've kind of listed those here. The relaxation training, also all of these techniques work for pain management as well. So they kind of have a dual function. Diaphragmatic breathing is really just that deep belly breathing, slowly in through your nose, letting your diaphragm expand and then back out through your mouth. When I teach this to kids, I do 5-finger breathing. So, you hold up your hand like this and trace with the other hand around. And as you go up, you breathe in. And as you go down, you breathe out. And that's like a really nice visual way for kids to kind of pace their breathing. And as they're learning, myself or you guys can kind of help them get the right pace of it so that they're not breathing really quick or really slowly, and find a nice, comfortable breathing pace as they do that. Guided imagery is really just using your imagination to think about being in a place where you feel calm and safe and relaxed. A lot of people like to think about being at the beach, but when you do this, you use all 5 of your senses and imagine when you're in that place, what are you seeing, hearing, feeling, tasting, and smelling? And what happens when you really tap into those senses and focus on what those sensations are, it actually tells your brain that's where I am, and it allows your brain and your body both to relax a little bit, and that eases some of the pain. Usually when people are uncomfortable and their muscles tense up, that relaxation can bring a lot of relief. And then progressive muscle relaxation is just tensing and releasing different muscle groups, usually starting at your head and working your way down to your toes. But as you tense those muscles, you want to focus on what that feels like in your body. And then as you release them, you focus on the difference and how it feels when that tension is gone. Another technique that we use is heart math. And that is an emotional self-regulation technique that really just tries to get your brain and your body into alignment. There's different pieces that go along with it, but there's a really cool app that we can use that connects to a little biofeedback device that clips onto your ear. And it shows your heart rate and it shows your breathing as it connects to the app, and it guides you through it. And it's a really nice technique that kind of combines some of these other like diaphragmatic breathing and other pieces of the relaxation that we work on. It combines them into sort of one cohesive technique. And this one's really good for our older kids, so that older school age and teenagers. And it's the biofeedback is very interesting and actually really helps with getting some buy-in from those older kiddos who might not be as interested in trying some of the other techniques. Having that actual physical feedback sometimes can get some of our more hesitant friends on board with what we're doing. But these are techniques that I can teach in clinic, or that we can send information home with to continue to practice. There's lots more besides the ones that I listed, but these are kind of my go-tos that I find really helpful. And then for DIY, I just suggest practicing these skills at home with your kids in sort of low stakes, very calm environments if you can. That way, if you find yourself in a situation that is stressful, you already have that understanding of how to use that skill. Practice makes perfect. So just keep working on them at home. And then that way, when you're in a situation where you need it, you have that skill already in your toolbox. There's lots of really great books and apps and resources available online, just outside of clinic, that you can find with a quick search. Some of the apps that I really like are the Breathe, Think, Do with Sesame, which is for sort of that younger preschool age kid. Headspace is a really common one. And then Insight Timer is one that I actually use myself, and that one is free. There's lots of different guided meditations and things on there. I have not looked on Insight Timer specifically for stuff for younger kids, so like school age. I don't know that they have things for them specifically, but for teenagers and for adults as well, there's lots of really good stuff on there. And then the other tip is just to make sure that you're managing your own stress as best you can and seeking support when you need it. We can't pour from an empty cup, so we want to make sure that our parents are taking care of themselves as much as possible. No, it's not always easy to do, but that helps as well when everyone in the family is really, working on those coping techniques together. The pictures that I have below are some of my favorite books on either side. The left and the right are both books that I like to use. Relax Kids is really, it's guided imagery essentially, but it's sort of like stories that you read, but they help you to focus on those different sensations that we talked about before. And then Breathe Like a Bear is another really good book that focuses a little bit more on mindfulness. That middle picture is just that Sesame Street app that I mentioned above. Okay, so the next thing we'll talk about is medication compliance. This is something I actually work on quite a bit with our cystic fibrosis families, because y'all know this, your kiddos take quite a few medications, and sometimes those pills can be a little hard to swallow. So I work with families to find ways to help make that process a little bit easier. Most commonly, that's just teaching kids to swallow pills, but sometimes it's also finding ways to make liquid medications a little more pleasant to take. The Crystal Light pictures we have in there, because that's what we use to flavor liquid medications. So we'll let kids pick if they want fruit punch or grape or lemonade, whatever they might like, and just mix that in with the liquid medication to kind of cover up the flavor. And then the Candyland is the game that I use to help teach pill swallowing. So we start with little teeny candies. So we'll start with sprinkles and then practice swallowing those and work our way up progressively to larger candies until we get to the size that's similar to the pill that a kid needs to take. And the game just makes it a lot more fun and is an easy way to practice. We also will create reward charts and things like that to help with motivation, to incentivize a little bit. Sometimes we have to bribe a little bit to get kids on board with it, but we'll work with families to try to find ways to make that process easier. And that italicized print at the bottom, FlavorBot is a website that shows you the best flavor pairings to go with different medications. Certain medications can't be mixed with like citrus or other flavorings because it doesn't interact well with the medication. And some medicines, there are certain flavors that work really well or certain flavors that just don't work. So this FlavorBot website can kind of point you in the right direction so that you're picking a good flavor covering for those liquid medications. So for DIY, just recommend practicing pill swallowing at home with candies, just like we talked about, starting with those small little candies and working your way up to the size that's the same as the medication. This is really helpful because there's, it's super low stakes. If they swallow it or they don't swallow it, it's not a problem because it's a piece of candy, but it allows you to experiment and find the way that works best for kids. I always tell them there's no wrong way to take your medicine as long as it gets in. So you sometimes have to do a little bit of trial and error in figuring out, do you like to put the candy in your mouth first and then take a drink, or do you like to take a drink and then put the candy in, or do you like to use a straw or drink right from the cup? But there's definitely a process of trial and error to kind of figure out what's going to work best. Like I said before, make a game out of it. It's a lot easier to get buy-in when the whole family's playing a game together versus kind of sitting by yourself and just trying to figure that process out alone. We like to use fun straws here at the hospital. We have, like those cute little curly straws or color changing ones. There's lots of fun stuff that you can use to make the process a little bit more exciting. And then I just recommend to incorporate medication times into your daily routines. It's something that people have to do every day, all the time. So it's really helpful to just make that a normal part of your day where you wake up, you brush your teeth, you take your medicine, we eat breakfast and go to school, and just have that be the anticipated course of their day. It can be something that you guys do together, where kids take whatever medicine they need to take, parents take whatever medicines they need to take, and there's just a time where we all do that, and that's a normal part of our day. So as much as you can make that a normal part of your routine, that can kind of help just set the expectation of when we take our meds and how that's going to happen. So another piece of child life is family and sibling support. This looks very similar to the support that we provide to our patients, but we focus on siblings and families. You guys are a whole unit, and we want to make sure we're taking good care of everybody. So we'll provide that same sort of education to siblings that we would provide to a child in the hospital. We will prepare siblings to come visit a child if they're in their hospital. We support their coping needs, and then we also provide some sibling support programming. One of my coworkers, the psychosocial aftercare coordinator, she does some really, really cool events with our siblings. That picture on the right-hand side is one of the events that she did. She's had to switch to virtual with COVID, and we're hoping very soon to be able to get back to in-person. But she does some really, really awesome stuff to support our siblings. And I can share that information with you guys as she does events throughout the year. So if you guys would like to participate, we can definitely get you connected with her. We do legacy building. Most of this is done with a program called Beads of Courage, which is a way for us to recognize kids' strength and their bravery with everything that they go through when they come to the hospital or come to their doctor's appointments. If you haven't heard of Beads of Courage before, the way it works is for everything that could possibly happen in the hospital or in the medical setting, there's a different color or a different type of bead to represent that thing. And so you end up with this really beautiful strand of beads that shows your story and the things that you've been through. So if you spent a few nights in the hospital, you would have a yellow bead for every night that you spent there. And if you had to have 2 pokes to try to get an IV started, you get 2 black beads. And when you come for your PFTs, you get a green bead, but you end up with this really beautiful visual representation of everything. that you've been through. And it's a really cool way for us to help kids reframe situations that might be challenging or stressful for them, and to help them see the bravery that they showed through those experiences. And it's a way for kids to be able to share their stories with their families or with their friends, and just kind of help them to see all the amazing things that they've been able to do in their lifetime. We do a lot of adjustment to hospital setting, and this is really just play normalization, trying to let kids be kids when they're in the hospital with us. Our playroom, that's a picture on the left-hand side there. I am trying very hard to get that to be a space that's open to our outpatients as well, because it's just such a fun place. But we work really hard to try to make the hospital setting a place that kids can be kids and have access to all of the things that kids should be able to do, regardless of whether they're in the hospital or not. We bring comfort items. We make signs to help kids share the things they like and share information about them, so that staff can really get to know kids on a personal level. So we have our psychosocial support programs that I talked a little bit about. They work right now with siblings, like I mentioned, type 1 diabetes, and what is the third one? I'm missing the third one. They work with specific populations. We're hoping to grow that, but the work that they do is sort of peer support groups, patient and family retreats, school reentry planning and visits, and then just ongoing psychosocial support. My colleague that works specifically with siblings does the programming aspect, but she also will do individual sessions with siblings to work on emotional expression, education, whatever really needs to be addressed. She can do that on an individual basis as well. She's been doing those via WebEx and doing them virtually. But like I said, we're hoping to get back in person soon. And then I want to talk just a little bit about how to prepare for your clinic visit overall. We talked about a lot of different pieces, of the medical play and procedural support, but just in general, coming to clinic, these are sort of the DIY techniques on how to prepare for that. So you want to start talking with your kids about their appointments ahead of time, letting them know that they're going to be going to the doctor. A good rule of thumb is for however many years old they are, you can kind of start talking about it that many days ahead. So, if you're 5 years old, 5 days ahead, you can start mentioning that we're going to go to the doctor and reminding them sort of periodically that that's coming up. If it's appropriate, talk about what's going to happen when you come to that appointment. So if you're having lab work at that visit, it's a good thing to start talking about a little bit ahead of time, and that way you can come up with a good coping plan. But just sort of walk through what that visit would look like as best you can. I know some things we can't always plan for exactly, but there's usually some standard parts of a visit that you can mention and that we know will happen consistently. Work with your child to come up with a coping plan for anything that might be stressful for them when they're here with us. Talk with them about what they want to do to try to make those difficult things a little bit easier, and then practice them ahead of time if you can. So practice those comfort positions and figure out how they might like to sit, and talk about what sort of distraction they might like. Talk about if they want to bring their teddy bear or their blanket or a comfort item with them, and just sort of plan ahead and practice those techniques so that you're ready to use them when you get to clinic with us. And then, like we talked about, just try to manage your own anxiety as best you can. I know when kids have a hard time coping with procedures, sometimes that can increase your anxiety coming to clinic, anticipating that they might have a hard time with something. But kids are really tuned into their parents' emotions. So generally, if we're stressed, they'll be stressed too. So as best you can, just try to use those coping strategies that we talked about, and make sure that you're feeling as comfortable as you can with everything, so that we can help the kiddos through whatever they're having happen that day. And this last slide is just some scripting. We call them words that works, but different ways to explain sort of common things that happen at the hospital to kids. This is really general wording, so obviously adapt it to make the most sense for your kids. I went for sort of a school age range, so you might need to, make it more appropriate for slightly older or appropriate for slightly younger kids. But to talk about appointments, I might say something like, we're going to go to the doctor that takes care of your lungs. We'll meet with lots of different people who help to keep you healthy. And that way they know that they're going to meet with pharmacy and social work and nutrition and all the other people that y'all see when you come to visit us. Kind of helping to understand that that's going to be, they're going to see multiple people while y'all are here. For PFTs, I might say something like, you'll do a test to see how your lungs are doing. During the test, you'll blow into a tube that will measure how your lungs are working, and the test won't hurt. For cultures, you could say something like, the doctors need to test your mucus so they know how to keep you healthy. The nurse will use a Q-tip to get the mucus from the back of your throat. This might feel tickly or scratchy, but will be over quick. Your job is to keep your mouth open wide and stay still. So we're explaining what we're doing, why we need to do it, how it might feel, and what their jobs are. And then for lab work, sorry, I have to move the little pictures on my screen so I can read. The doctors need to do a blood test to see how your medicine is working in your body. They'll need to do a small poke with a needle. Your job is to stay still and take deep breaths. Would you like to watch a show, or would you like to blow bubbles during your poke? So again, kind of explaining what it is, why we're doing it, and then giving options and expectations for what their job is going to be. There's obviously lots of different things that would happen at clinic. I only captured a very small number of them, but hopefully you guys can kind of see how we might use our language and what words we might pick to help explain those things. And then lastly, just how to request child life support. If you're in clinic or admitted to the hospital, you can ask just about anybody to call Child Life. We have lots of ways for them to reach us. So if you don't see a child life specialist, just ask and they can call us. Outside of time at the hospital or at the doctor's, I'm reachable through my chart. So you can just search my name and send me a message, or you're always welcome to email me. That's my email address right there. And I'm happy to respond that way or set up a time to talk by phone. But whatever we can do to be helpful, please don't ever hesitate to ask. We're always more than happy to come and chat and see what we can do to be helpful. Well, that is all that I have. But thank you guys so much for being here and letting me share a little bit about my work. I'm really glad I got to come and talk to y'all tonight.
Thank you for sharing so much wonderful information, Jordan. It was really amazing. A lot of really, really helpful information. I don't know if any of the parents have questions. Do you have time to take a few questions?
Yeah, absolutely.
Anyone have any questions or?
Yeah.
Hey, so I thank you so much for taking the time to go over all this. This is like probably my favorite Zoom meeting thus far. It's incredibly helpful. But I had a question that I've learned a lot through Child Life and just watching how they do things. And, there's one piece that I'm always, I don't want to say is awkward, but I always wonder how to go about it. For instance, now that she's out of the room, like button changes, like with G-tube changes, or even like blood work. In the moment, when you're in the moment, I can imagine, saying, hey, it's okay, trying to comfort them. It's not really registering, but do you have any advice on things that could potentially be helpful when you're in the moment, if that makes sense? Does that make sense?
Yeah, no, absolutely. It is really challenging when we're already upset to kind of jump in there and find a way to bring it down. Something that we'll try to do is, like I said, with that one voice, just try to keep the room as calm and quiet. And that's not necessarily your job as mom. Hopefully with a child life specialist there, we can kind of help to facilitate that. That shouldn't be on you necessarily. But we want to, ask everyone to kind of bring the level down so that you guys can hear each other and you and your daughter can make sure that you're able to communicate. We like to recommend saying things like, you're safe. A lot of times people will say, you're okay. And when kids are upset, they're not feeling okay. And it doesn't always have the intended effect. Sometimes it does, and it's fine. And sometimes it can kind of push you in the opposite direction. So I like to say things like, I know you're upset. I can see you're having a hard time, but you're safe. We're trying to help you. And I cue a lot just for that deep breathing, which is why it's really helpful to practice it ahead of time, because you have that skill and you know what to do in the moment. And if they hear you say, take a deep breath, and they see you take a deep breath, they sort of know how that works.
Okay.
And then I will try my best if I can, and if it is appropriate, to just redirect to something something distracting, whether it's a video or just a conversation. We don't always have, a distracting item with us, but sometimes just kind of guiding back to a different conversation, or talking about your pets at home, or, tell me about the vacation you're going to take, finding a way to sort of focus on something a little bit, more comfortable for them, can be really helpful too. It is challenging though, for sure, once you're kind of already upset, to rein that back in a little bit. But yeah, the breathing, the distraction, just trying to keep the environment really calm, and trying as best you can to, keep yourself feeling as calm as you can as well, so that feeling doesn't transfer necessarily. I hope that's helpful. I know that it's a hard one.
Yeah,
One to
I always get it. And like, I feel like in those situations, I'm constantly questioning, am I being helpful, or am I making matters worse, or what? So
Right.
all of that was perfect. And also I especially like, reminding them that they're safe, and validating their feelings. And of course, distractions don't always work, but those were incredibly helpful tips. I appreciate that. Thank you.
Absolutely.
No, you can't do that.
Does anyone else have a question? I must say, I put a poll at the very beginning of the presentation, but not everyone is here. I don't know that you said that there are 20 child life specialists, and there are room for 21. I don't even know so our girls are older,
Yeah.
now, but I don't remember there being child life specialists.
Oh yeah,
there were.
Yeah.
I don't even remember them helping with procedures or anything, but maybe it's just such a blur to me.
Yeah, I remember. We went down to that playroom.
Well, I remember the playroom when they were in the hospital. But that's the only thing. Like, I only remember inpatient. Seeing someone on an inpatient basis.
Yeah,
true,
there's a lot more of us now than there were probably just in the last 4 or 5 years. We've grown quite a bit. But yeah, we're all throughout the hospital. It can be a little bit hit or miss if we're around when things are happening, but we're very lucky to have grown as much as we have in the last few years. And then the clinic program that I started, I think was in, I'm going to say 2017. So that's a more recent development as well.
Okay, well, I think it's great. It's really wonderful.
Yeah.
Someone else in the chat said thank you for a great session. A couple people did. Does anyone else have any other questions? I thought it was phenomenal. I don't know if you're willing to share your slides, but I did record the presentation, and I'll make the recording available. And if you don't have to answer on the right now, but if you're willing to, I can get them from Ellen or directly from you. So
yeah, definitely. I'm more than happy to share them for sure.
Jordan, can I ask a quick question?
Yeah, absolutely.
So thank you, first of all. That was phenomenal. I feel like I learned so much. You're going to be hearing from me. But so you did a fantastic job of explaining sort of age appropriate interventions and different kinds of things that you do for different age groups. And I'm just curious, is there an age that's too young to call child life for support?
No, we work from birth all the way through, sometimes over 18 into the early 20s. In terms of procedural support, really, really little infants, there's not a ton that we can do additionally. Parents are usually the best support. But really, once a kid is, I don't know, I honestly kind of able to sit upright, there's a lot more that we can do to be helpful. But we work with all ages, and if there's ever any question of whether there's something Child Life could do, I would always prefer that people call and we can kind of make our assessment and see what we can do. And sometimes what we're doing is just setting up the environment to be comfortable. Sometimes there's not necessarily even direct support that we can provide to really little patients, but there are things we can do to help parents feel comfortable and to advocate for things like sweeties and pain management and things like that. Sometimes it's not even the direct patient care, but there's still behind the scenes work that we can do just to try to set people up for success.
Awesome. Thank you.
Yeah.